Moderna, Pfizer, Johnson & Johnson, AstraZeneca. You've heard these names plenty of times, but do you know how the COVID-19 vaccines compare to each other? Make room in the medical history books. For the first time, vaccines have been made using RNA technology, though the technology has been in the works for a long time. A 2018 Nature Reviews drug discovery article reported that mRNA vaccines show promise in battling a slew of infectious diseases. With the urgency of the coronavirus pandemic and the global collaboration of scientists, the timetable to create an mRNA vaccine was moved up. That said, scientists still had time to perform multiple studies testing for safety. The Centers for Disease Control and Prevention explains that mRNA vaccines, like the Moderna and Pfizer COVID-19 vaccines, teach the body to make a small, harmless viral protein. The protein is quickly detected and neutralized by immune cells, but it's enough time for immune cells to remember it. The first dose of mRNA vaccine acts as a study guide, prepping the immune cells on what's to come and quizzing them on how to best address a potential threat. The second dose works as exam day. The immune system has studied and knows the material, in this case, the spike protein, like the back of their hand. When it encounters the viral protein, it quickly answers by deploying a robust immune response. Just as there are many ways to make a cake, there are several ways to make a vaccine. Pharmaceutical companies AstraZeneca and Johnson & Johnson took a more conventional route and used a weakened or dead virus to stimulate the immune system into action. JAMA explains that these vaccines, dubbed viral vector vaccines, work by injecting a weakened adenovirus, the culprit for the common cold, but it also houses a gene for the SARS-CoV-2 spike protein. The vector is designed so that once in the body, it's unable to cause infection. Once in the cells, it releases viral DNA. Then, the cells use the viral DNA to produce harmless spike proteins, which alert the body of a foreign presence. It destroys it, leaving behind antibodies and immune cells with an encyclopedic memory that can recall and alert the immune system when the spike protein is detected again. The Centers for Disease Control and Prevention confirms that viral vector vaccines have been well studied in clinical trials and are effective in taking down deadly infectious diseases. The bottom line is,
when the vaccine becomes available, take it.
Unlike the other COVID-19 vaccines, Johnson & Johnson is a one-and-done shot. It takes just one dose to create a robust immune response. This one dose is 66% effective at preventing moderate and severe COVID-19 infections and hospitalization. Cody Meisner, a pediatric infectious disease specialist from the Tufts University School of Medicine, explained at an FDA advisory committee meeting, "It's important that people do not think that one vaccine is better than others. All of them seem to be equally effective in preventing severe disease with intensive care needs and death." Dr. Sandra Freihofer, internist, told the American Medical Association, "The good thing about the Johnson & Johnson vaccine is it's one dose and you're done. You don't have to go back for a second dose. You don't have to make a second appointment. You can get fully vaccinated at one visit." Except for Johnson & Johnson, all other COVID-19 vaccines in circulation as of this video require 2 doses to achieve full immunity. A February 2021 report in JAMA explains that 2 doses are necessary because clinical trial research from Moderna and Pfizer found, quote, "a relatively weak immune reaction weeks after people were administered 1 dose." However, a more robust immune response was observed when given the second dose. JAMA also cautions that partial immunity could lead to less protection against COVID-19 variants. JAMA put it plainly, "There is no evidence that people who get only 1 dose have adequate long-term protection against COVID-19 infection." There has been a lot of discussion over the efficacy of one shot with the AstraZeneca vaccine. However, the World Health Organization continues to recommend 2 doses. They say further research is needed to test the long-term effects of a single shot. In areas where the AstraZeneca vaccine is given, you will need to return for a second dose, but not for a while. A preprint study, meaning it is yet to be peer-reviewed and verified by scientists, suggests that scheduling doses farther apart may provide even better immunity. The results showed the vaccine was 82.4% effective when delayed 3 months apart, compared to the 54.9% efficacy observed 6 weeks apart. WHO likewise recommends some time between doses, specifically 8 to 12 weeks, or 2 to 3 months apart. While it's essential to receive 2 doses of either the Moderna or Pfizer COVID-19 vaccine in the US, and while you should make every effort to make it to your scheduled appointment, there is some wiggle room. The Centers for Disease Control and Prevention says the Pfizer-BioNTech vaccine should be administered 21 days apart, and the Moderna vaccine should be administered 28 days apart. The timing mirrors the timing of when the second dose was given in clinical trials. The CDC recommends sticking to your appointment date whenever possible, of course, but the vaccine efficacy shouldn't change if the second dose is administered 4 days earlier. And if you must delay your second dose, both mRNA vaccines can be given up to 6 weeks after the first shot. The AstraZeneca COVID-19 vaccine has not been authorized for use in the United States because the maker has not yet filed for an emergency use authorization with the U.S. Food and Drug Administration. When AstraZeneca announced its initial results of its vaccine being 90% effective, it soon came to light that different doses were used in the trial, making results inconsistent. In March 2021, AstraZeneca released its Phase 3 trial results showing high effectiveness and no safety concerns. But in less than a day, the National Institute of Allergy and Infectious Diseases released a statement saying that, quote, AstraZeneca may have included outdated information from that trial, which may have provided an incomplete view of the efficacy data. The vaccine has also been under fire for the potential to cause blood clots, causing some countries to suspend use temporarily. The European Medicine Agency finds a very rare potential risk for blood clotting. Based on the results, AstraZeneca announced in early April 2021 that it's updating its vaccine label to include the warning. Could this vaccine make its way to the States? Dr. Anthony Fauci, the top infectious disease specialist in the U.S., told CNN in early April 2021, even if the FDA deems that this vaccine is a very good vaccine, we don't need yet again another very good vaccine. We have enough very good vaccines. At the end of 2020, scientists found several strains with different mutations on the coronavirus spike protein. The B.1.1.7 variant, aka Alpha, is one example where mutations helped make it more transmissible and deadly. Since its emergence in the UK, it has become the dominant strain in the United States. Other strains, including ones found in South Africa and Brazil, have mutations that allow them to be undetected by the immune system. Moderna and Pfizer vaccines were created before the variants of concern began circulating worldwide. Nevertheless, Pfizer, Moderna, and Johnson & Johnson have proven to work effectively against the B.1.1.7 variant. Additionally, the Johnson & Johnson vaccine was tested in clinical trials in Brazil and South Africa when the variants were circulating. While Johnson & Johnson's COVID-19 vaccine has a lower overall efficacy than the Moderna and Pfizer vaccines, the University of California, San Francisco explains that it nonetheless shows strong protection against severe infection and hospitalization.
So even though the prevention of mild disease is lower, then the prevention of severe disease, hospitalizations, and death is outstanding.
Even though it's rare, allergic reactions to the COVID-19 vaccine can occur in people who have a history of allergies after vaccinations. Reena Patel, a board-certified medical doctor in family medicine and urgent care physician at Garnet Health, told Verywell Health, data early on showed about 1 in 100,000 chance of having a severe reaction. The overall risk is still small, but in the group of people who did have a severe reaction, more than 70% had a previous history of severe allergies. The Centers for Disease Control and Prevention says allergic reactions can occur from an ingredient of the vaccine. They advise people who are allergic to polyethylene glycol to avoid the Moderna and Pfizer vaccines. Instead, they should see about getting the Johnson & Johnson vaccine. On the other hand, you should not get the Johnson & Johnson vaccine if you have an allergy to polysorbate. Instead, request either the Moderna or Pfizer vaccine. The CDC explains that it's important to discuss with your doctor whether a COVID-19 vaccine is safe for you to take if you have allergy concerns over ingredients, or if you're allergic to other vaccines. To end the pandemic, the world needs to reach herd immunity. AstraZeneca might be the key to achieving this. According to Business Insider, AstraZeneca pledged not to profit from its vaccine during the pandemic. Plus, their manufacturing and distribution make it cheaper to distribute than the Pfizer and Moderna vaccines. And unlike the mRNA vaccines, the AstraZeneca vaccine can be stored in a regular fridge for up to 6 months. AstraZeneca said in a press release, The vaccine's simple supply chain and our no-profit pledge and commitment to broad, equitable, and timely access means it will be affordable and globally available, supplying hundreds of millions of doses on approval. The convenience of the AstraZeneca vaccine will help make vaccines more accessible to countries that cannot compete with massive vaccine purchase orders from the United States and the United Kingdom. The downside to the Pfizer and Moderna mRNA vaccines is their storage requirements. They need to be stored in specialty freezers. According to Science News, mRNA is fragile and needs to be kept frozen to ensure it doesn't break down before injection. Inflexible storage requirements make it less viable for some other countries. Jessica Atwell, assistant scientist at Johns Hopkins Bloomberg School of Public Health, told Verywell Health, "Doing that in high-income countries like the US is one thing. Trying to do that in low- and middle-income countries around the world, where even a normal 2 to 8 degrees Celsius refrigerator-like temperature can be really difficult in many parts of the world." Vaccine side effects may not be pleasant, but they're not a bad thing. They are a sign that your body is in training and getting ready to knock out COVID-19 if it ever shows up. While side effects are a good sign, just knowing this fact doesn't make them any more fun. However, Healthline revealed that fewer people reported side effects with the Johnson & Johnson vaccine compared to the mRNA vaccines in clinical trials. And most side effects from mRNA vaccines tend to happen after the second dose, which isn't an issue with Johnson & Johnson's single-shot dose. Of course, this doesn't guarantee that the Johnson & Johnson vaccine always comes with more minor side effects. In early April, the FDA temporarily halted the use of the Johnson & Johnson vaccine to analyze 6 reports of a severe blood clot following vaccination. The FDA revealed on April 23rd, "We've lifted the pause based on the FDA and CDC's review of all available data, and in consultation with medical experts and based on recommendations from the CDC's Advisory Committee on Immunization Practices, we have concluded that the known and potential benefits of the Janssen COVID-19 vaccine outweigh its known and potential risks in individuals 18 years of age and older." All FDA-authorized vaccines are effective against COVID-19, but numbers show they differ in efficacy. Stat News revealed that the Pfizer vaccine is 95% effective at preventing symptomatic infection from COVID-19 after 2 doses. In contrast, the Moderna vaccine is 94.1% effective. Johnson & Johnson's one-shot vaccine is 66% effective against moderate or severe COVID-19 infection globally, 72% effective in the United States, 66% effective in South America, and 57% effective in South Africa. The differences are because of the variants. Moderna and Pfizer released their clinical results before the emergence of variants. For this reason, it's difficult to compare each vaccine because they were created at different time points in the pandemic and with different populations. As Stat News explains, Moderna and Johnson & Johnson's COVID-19 vaccines are authorized for use in people 18 years and older in the United States. Similarly, the European Medicines Agency approved the AstraZeneca vaccine for people 18 and up. The Pfizer vaccine was first authorized for people over the age of 16. In April 2021, Pfizer submitted a request to the U.S. Food and Drug Administration in an effort to expand emergency use authorization to 12 to 15-year-olds based on a pediatric trial in which the company found a 100% efficacy in preventing severe infection. The following month, the FDA authorized its use in children aged 12 to 15. As of this video, Moderna and Johnson & Johnson are conducting clinical trials to test their COVID-19 vaccine safety and effectiveness in adolescents. Check out one of our newest videos right here, plus even more Health Digest videos about your favorite things are coming soon. Subscribe to our YouTube channel and hit the bell so you don't miss a single one.